In today's public service announcement, we'll be talking about hepatitis B. Did you know that hepatitis B affects approximately 296 million people, including over 6 million children under the age of 5? Crazy. In the United States, rates of new hepatitis B infections are highest amongst adults ages 30 and 59, reflecting low hepatitis B vaccination coverage among adults at risk. The most common risk factor among people with the new HPV infections is injecting drugs related to the opioid crisis and other drug issue. So you're probably wondering, why are we even talking about it? Or what is it? Well, hepatitis B is a liver infection caused by the hepatitis B virus. People with this infection can be sick for a while, but for others, the disease can progress into a serious lifelong illness known as chronic hepatitis B. I bet you're wondering, how does someone even get this disease? Or how does it even affect the liver? Well, hepatitis B is spread to others when blood, semen, or any other body fluids from a person infected with the virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment from a mother to a baby at birth. Some symptoms of disease can include fatigue, poor appetite, stomach pain, nausea, and jaundice. It causes inflammation in our liver tissue, which is what hepatitis means. It begins an acute infection that usually is short-lived, but in some people it turns into a chronic infection that never goes away. Hepatitis B can be serious at some point, and when it does, it can result in long-term health problems, including liver damage, liver failure, liver cancer, and even death. There were over I don't know how to say that number, but 1,752 deaths related to hepatitis B virus reported to CDC in 2020. But this is an understatement. Don't worry, hepatitis B is a vaccine-preventable liver infection, which means it can be handled before things get even worse. It can also be prevented. The best way to prevent hepatitis B is by getting vaccinated. The hepatitis B vaccine is safe and effective. You need to get all shots in the series to be fully protected against it. Doing that can lower your risk in developing hepatitis B or spreading the virus to others. Using condoms or other barrier methods during sexual activity can prevent hepatitis B spreading with body fluids. You always get tested regularly before being sexually active. We all know sharing is caring, but be sure not to share any personal items that might contain blood, such as razors, toothbrushes, and not sharing needles or syringes. That's it. That was really fast. Okay. And even dead. 6 million children under the age of 5. In the United States, B infections are highest amongst adults aged The most common risk factor among people with the most common risk factors among my freaking